Hey everyone, you're now listening to Cup of Queens with Paige and Saray, and we're so excited to have Dr. Rachel Ness, the owner and founder of Fargo Center for Dermatology. Dr. Ness cares deeply about her patients and strives to give them the best results, whether it is on the medical or aesthetic side.
Dr. Ness talks with us about common concerns she hears from her patients, how dermatology has evolved, and what the perfect skincare routine looks like to her. We also put Dr. Ness to the test and see what her recommendations are for a variety of skincare concerns, such as dry skin and improving your complexion.
So grab your cup and enjoy.
I mean, we're rolling.
You're
good to go.
Yay! We're so excited. We are so excited to be at Fargo Center Dermatology. We're going to cut that out. I'm so sorry. Okay, we're off to a rocky start. We're all a little nervous because we are in the presence of Dr. Rachel Ness. And we are so excited to hear from her and pick her brain on all the fun things that she has coming. And we're just ready to dive in. So tell us about yourself.
All right. Well, I am so excited to be here with you two. So I'm here with two celebrities. So myself, I think I'm a little bit nervous here today. So, well, I'll tell you a little bit about myself. Hopefully I won't bore everyone. I am from North Dakota, so just like Fargo Center for Dermatology is here to serve the community, my whole life has, really been about North Dakota. So I grew up in North Dakota, went to my undergrad and my medical school at UND in Grand Forks. I knew I always wanted to do dermatology, so North Dakota does not have a dermatology residency program, so if you want to become a dermatologist, you've got to leave the state. So I left the state for 3 years and went to Wisconsin and did my dermatology residency. And then 14 years ago, after I finished my dermatology residency, I always knew I wanted to come back to Fargo. So came back to Fargo. This is 14 years ago. I've had my practice here in Fargo for 14 years. With the love and support of my husband, and I have 3 children. I have 3 boys, and I have a 10-year-old, a 10-year-old, and a 13-year-old, and I do have 1 female dog, though, that keeps me sane, at my house, so her and I are against the other 3 guys, or the 4 guys in our house, so.
What kind of dog do you have?
We have a chocolate lab.
Okay.
Yeah,
we're a huge dog people. So
she's
love
like
that.
the sweetest thing ever. So yeah, so she's just lovely. So, so that's kind of my story. Is right away I knew I always wanted to. I interviewed when I finished residency and decided where I want to practice, and there's so many great options for dermatologists to practice. But in the end, I knew that there was a very particular way I wanted to deliver my care, and if I wanted to deliver it that way, I knew I was going to have to start my own business, and so it meant a lot of work, a lot of hours, but it's been worth it, and it's been 14 years, and we've just been continuing to grow, over those years, and. Yeah. I grew up with atopic dermatitis, so I don't even remember my pediatrician. I only remember my dermatologist, and I always knew I wanted to be a dermatologist, and spent many years checking out other things and other fields just in case, but I always came back to that. I was born with hemifacial hypoplasia, where like half my face was smaller than the other one because I had torticollis.
Really?
So I know the importance of aesthetic procedures to just feel confident. I know the importance of treating severe atopic dermatitis when points in my life when I wanted to cut my hands off when I was a child and I was so embarrassed to go to school, because my hands just, children made fun of them and they wondered what was happening, to my hands. And then, I suffered from acne as a teenager, which being a teenager is just tough enough the way it is. So those are kind of some of the reasons that just led me, to the dermatology path. And now I couldn't imagine anything else that would give such great satisfaction other than being a dermatologist.
Yeah. And
I love that.
You're changing lives and, helping women and men build confidence in themselves. And I think that's so cool. And I have to ask, out of all the things, because you do so much here. Yeah. I mean, the list of services and procedures and, different things that you guys carry here is absolutely incredible. What is your favorite thing to do?
Oh my gosh, that's not even a fair question.
And if you need to rattle off a couple.
Yeah.
My favorite thing to do is to help my patients, and so, in one single day, helping my patients, it can be 10 different things. It can be helping that teenage girl that walks in the office, and I remember being 13 and you could not pay me to go back to be a 13-year-old girl.
Same.
And if I can take that one thing away, that one stressor away from her, is like feeling like she can't get out of bed in the morning because she has scarring, acne. She doesn't have the confidence. In 6 months, I can cure people's acne, and like the changes that you can see in teenage boys, teenage girls, or even adult women or adult men that suffer from, acne or any condition that makes them lack confidence, is probably the biggest, like my favorite thing, is really making patients like smile, that when they walk in the office and say, oh my gosh, Dr. Ness, I didn't even know that was possible, and we take a lot of pictures on our baseline visits. Like, I'm like, hey, do you mind taking a picture? And you just see that whatever the patient's in for, they just cringe because they're embarrassed. They don't even want me to take a picture. And I say, you are going to be thankful that I take this picture. We're not posting it. We're doing this for you in your chart. And when I show them 3 months, 4 months, 6 months, they say, I cannot believe I walked around like that. And whether it's their psoriasis, their atopic dermatitis, if it's, or if it's from their acne, but, showing them, what you can do, and then you can just see their light. They just continue to just start to light up more and more every time that you see them. So ultimately, that's my favorite thing. I gave you examples of medical things. We can do very similar things on our aesthetic side, giving someone a filler, a laser, hydrofacial, getting them on the right products, there's so many things, that we can do just to build that confidence. I mean, but if you had to say what is my favorite thing, it's probably just connecting with my patients. It's not a particular like service.
Yeah.
I am so lucky because I get to connect with people every day. Some of my patients I've seen for 14 years and I get to see their kids, their grandkids. And so I think it's the connections that are really, my favorite part. I know that has nothing to do with dermatology, but that's probably my favorite.
Yeah. But I think that says a lot about you, and the way that you run your practice is you really care about the person and the patient. And so can you talk with us a little bit about the changes and how dermatology and the aesthetic side and all of that has evolved, since you started 14 years ago?
Yeah. It's really, my practice is probably, significantly changed. I have patients who, like, I remember when I saw you when you first opened 14 years ago, and, you only had 3 staff and, 4 rooms, at that time. And they're like, I'm so proud of you, and so, they see the change sometimes even more than I do. And so I think the biggest change is when I started 14 years ago, we didn't advertise for years and years. We were just under the radar. We had full schedules, we had amazing patients, we had great staff. We had a certain, square footage that we could work with, and we weren't really able to expand, for a while. So I think what happened over time is, eventually we started out with, like those, 1,500 square feet, and then it eventually evolved, 7 years later to like 3,000 square feet. And then 2.5 years ago, we, started and we moved over to 8,000 square feet. And then pretty soon, in a month now, we're going to be, up to 10,000 square feet. And so I think that that just tells you the footprint. That's all that tells you. But I think that's sometimes helpful for people to see. So now what are we doing with that square footage? We're expanding like both of our medical services and our aesthetic services.
Cool.
We're doing.
That's
so
exciting.
So both of those. And I think that one of the really things with that is we get to kind of, we're adding some cool things that sometimes we're the only ones in the state that are doing some things. Our most exciting thing that we're bringing on recently is we're adding IGSRT, and what that stands for is IGSRT stands for Image Guided Superficial Radiotherapy. So we're the first ones in the state that are bringing this on. Before, my patients had to drive all the way to Minneapolis for the service, and this is specifically for a non-surgical option for treatment for some types of skin cancers and for keloids. Those are those huge scars that can be really disfiguring and debilitating. So we brought that service on here recently. So it took us a while to finally be able to bring that service on. And, we were having patients driving all the way from Minot, to come and see us. And so that's been another addition. Cool. And it's been something useful we've been able to do with our square footage. And then in addition to just really our aesthetic addition is really being able to have us to offer just a more elevated experience.
Cool.
In a really neat setting, and be able to just add on to our current services.
Oh my gosh.
Awesome.
I think it is absolutely crazy how stuff has transferred over to laser or light therapy. which I don't know a ton about, but I find it fascinating. So can you speak to the different services that you guys carry that kind of fall under that?
Yeah. So you're kind of talking about like that technology piece, of it, and technology is always evolving. Sometimes I put it into a couple different categories of it. One I think about is like technology. We have body contouring technology. So three kind of things that we do is we do cool sculpting, which is a fancy name is the cryolipolysis, and that's basically taking those fat cells and killing those fat cells, and then basically your body absorbing them, and that's permanent. So that's a really, really great way for doing body contouring. Another cool service that a lot of people don't know about is Cool Tone. And again, Cool Tone is actually using a machine to actually activate the muscles. So because, if you get rid of fat, if you don't have muscle, we've got to get that metabolism going. Right. So we can really, really help people, tone the body, but also functionally, we've seen a lot of benefits. People who posturally, back pain improvement.
Wow.
Women who've had, who are postpartum, have had kids. They have separation of those ab muscles. I'm a mother of twins, and I know all about that. Like, those muscles just don't pop back to where they need to go. So using technologies to help, increase muscle, to help with posture, function, back pain, hip pain, those types of things. So that's kind of our body contouring, in addition to, fat injections that we can do for like submental fat, issues. When you kind of get into questions about more kind of lasers and probably microneedling, those types of things, we have, one of my favorite lasers here we have is a 3 for Me, and that's where we actually do 3 different types of lasers in one visit. Okay. We do something called non-ablative fractionated laser. And non-ablative, that's a really important word. It probably means nothing to you, but it means that minimal downtime. Okay.
Really?
So non-ablative, so you think of it like aerating a lawn. You come home after someone aerated your lawn and you're like, oh my gosh, why did we pay for this? Your lawn looks terrible, right? Well, it's damaging those little cores, and then knowing that the surrounding lawn is going to come in thicker and more beautiful. It's the same concept with your skin. Okay?
That is such a good way to explain it.
So, and again, it's like you got to get a little worse before you look better, But then we know that that's not the most important things. We've also got to go in and think about adding that like fertilizer and kind of clean up the top. So we go in and we add some different IPL and other technologies to get rid of the browns and the reds, but also stimulating the collagen. So those are one of my favorites. I do that for browns and reds. I struggle with rosacea myself, so I do a couple of those every year. And that is one of my favorite things for just trying to, like, when women say, I just want to look back, in 5 years or look ahead in 5 or 10 years and like, I wish I was doing things to prevent myself from aging. Yeah. So these devices actually prevent that. Another one of my favorites is something called Vivace that we have here. And that's a little bit different because it actually takes microneedling. So a very similar thing with aerating the lawn. You're damaging those little cores. The issue, what we're doing with that is we're taking those microneedles and we're adding radio frequency technology. So if you think about your skin here, we do our first pass, we'll drop in deep. We'll leave that radio frequency there to tighten. So not only is it causing that damage, it's actually tightening on those. And then we'll do a second pass after we're done, and we'll drop it in only half as deep. So we're getting at 2 levels, of the skin. So we've got the microneedling plus the radio frequency. And then we've had for years, we've had the skin pen. So skin pen is another type of microneedling. It just doesn't have the radio frequency. And we choose those technologies based on, is it more anti-aging? Is it acne scarring? Is it textural issues? Sure. And we know which one we need to pick on those. And then we add sometimes with those topical PRP or injectable PRP. So that actually means like drawing your blood, spinning it down, taking out those platelet-rich plasma cells, and then putting it topical in the face to take advantage of the fact that we just created thousands and thousands of holes on your skin. So now we can absorb that, It decreases the downtime, increases your results. And then my favorite one is the periocular rejuvenation. So women are always saying, why do I have these bags under my eyes? Yep. So then we'll go in and we'll do a bunch of injections around the eyes. Super safe thing to do, a great alternative to fillers. So those are other things, that we do. So lasers, lights, technology, microneedling, radio frequency are other things that we can do for just really rejuvenation, skin tightening, browns and reds. And other people just need some simple technology. I have some women that just come in and say, I just need to get my browns and reds taken care of. And that's really your kind of your photofacial or IPL that we do every year on those. So those are some of our favorites. Other technologies that are just for maybe more conservative is, we do a lot of hydrofacials with a lot of boosters just to keep maintain things on those. So that's really another popular service that we have.
Cool. So because the thing under the eyes, that is where you can do to like get rid of the dark circles, right?
Yes.
I'm like, I want to do it so bad.
I complain about this all
scared.
the time, and Paige and I talk about under eye a lot.
Yeah.
Try out every concealer, I swear.
Yeah.
But, okay, so is this filling? It's not filler, though. It's different.
Correct. Yep. And so you notice I just said an extremely safe way of addressing that periocular rejuvenation without fillers.
Right.
Because I have some patients who just say, you're not touching me with a filler.
Yeah.
You know? I mean, so this is a nice, gentle, natural way.
Cool.
So we are just using your body, okay, to stimulate things. So this is a great introduction, especially when you're like young and gorgeous like you two. And I'm like, you guys do not need filler under the eyes. But I say, but let's just keep you where you're at.
Right.
By using your body. Let's just drop in a little bit. Super safe. There's like no risk, okay, with this.
Wow.
We've got to have a little bit more, just risk discussions with fillers and stuff. And so I was trying to do things as natural as I can, as safe as I can. And then if we can't achieve our results, I'll say, yeah, let's go on to the next, next step. So you're asking me, okay, it's just a question that, 50% of the women ask is, what can you do about my eyes? And especially because we've all been masking for a long time.
Yeah.
And what have we all been looking at is we've been focusing on our eyes now. So I think that's brought a whole new focus to the eyes, It's brought a little more focus away from the lips and maybe the lower face rejuvenation and a little more attention, to that eye area. So that's where we go in. So to do the complete periocular rejuvenation, that means like fixing the areas around the eyes. It's combination treatment. So I'll say, what are you using? We got to get you on a good eye cream. So we've got 3 or 4 different eye creams, just depending on what are your issues, So we'll get you on a good eye cream. If you're using one at home, we say bring in what you're using. We'll look and make sure it's got the right ingredients. So I'm not like brand specific, but I'm ingredient specific. Then we'll say, okay, do we need to do some PRP injections around that area? Maybe you truly do need some filler. So, if you have a lack of your cheeks, because over time all of our faces go south, okay? We lose our fat pads, everything goes south. So if I just drop in a little bit of fill your cheeks, oftentimes that will just move things up and you don't even need anything around the eyes. So we have to remember that let's just replace this and that might fill in. Maybe we'll decide that skin pen microneedling or Vivace, is appropriate for you. For really more aggressive treatments, we even have done we do CO2 lasers around the eyes where we actually we put in numbing eye drops, put in metal shields in the eyes, and we actually do an ablative CO2 laser. So that means downtime. Okay. So that is not for everyone. But that's for my women who have pretty significant damage where we're like teetering between, do we refer you out for eyelid surgery versus let's try and do a CO2 ablative fractionated laser. So ablative means we're actually damaging those cores. Okay. Gets more results and less treatments, but it's more for women who are a little bit more, men or women who have an advanced, aging issue or more prominent wrinkles. Other things around the eyes, that we talked about the PRP, Vivace. There's so many things. We just need to, why do we see those bags? It's all because as we age, our skin gets thinner. So we just see those little blood vessels that we all need under there. So we see this, we call it the Tyndall effect, under there. So we've got to thicken the skin up with products, skin pen, microneedling, lasers. Then we've got to fill in any deficits with maybe some fillers. We've got to stimulate that collagen, maybe with some PRP injections, in those areas. And then maybe we need to just do a little bit of neurotoxin, so Botox, Dysport. We'll do some injections around the eyes. My favorite one that I do is just right on the lower eyelid. We call it the donut roll, right underneath our eyes.
Botox under here?
My favorite one, I drop in like 1 or 2 units on your lower eyelid, and it literally can prevent you from, like, if you smile for me,
like the under
smile again. So she's got a little donut roll, there, just to help soften that, because every time she smiles, she has a beautiful smile, but guess what that does? It wrinkles her skin. And what happens if you have a pair of linen pants at home and you wrinkle it? You let go of your wrinkled linen pants and you're like, oh my gosh, why are all these wrinkles there? They stay, and you work forever to, like iron them out. It's the same thing with their skin. If you constantly smile, which we all want to smile, but it's going to wrinkle those skin, and then it's just wear and tear, on the skin. So if we can just keep up with a little bit of, Botox around the eyes, do a little bit here, targeting those muscles, relax those lines. We can prevent it so that you don't walk into my office when you're like 50 or 60 and say, how come I have all these lines? We've got to do a lot more work to fix those versus if we just put a little time and energy into preventing those lines and keeping up with just gentle things, we can prevent you from getting to that point where you look in the mirror and say, what just happened? So.
Well, do you have any time after this? We can stay a little extra.
Right. Let's make an appointment right now.
I'm just teasing. But I am curious. Yeah. So for some of our listeners that maybe aren't into getting different injectables or, different things like that, what are some key points for just different preventative products that are really great, or maybe different foods or, different things you recommend?
Yeah, I think that's a great question. So one of the things is just, how do we prevent premature aging? Is kind of what you're talking about. So having a healthy lifestyle, if you haven't stopped smoking, make sure you stop smoking. I mean, they've done some amazing studies on showing even just stopping smoking, what it does. Your skin is so magical, and it will reverse some of that damage. Staying hydrated, is extremely important. Having a well-balanced diet, more of that Mediterranean diet, and not that's an anti-inflammatory diet. A lot of our skin conditions are related to inflammation. So having a good diet is really helpful. Other things for just kind of preventing is just doing some preventative skincare. As far as, I always say, if there's like one thing that you're going to do, it's a sunscreen. Because I always have to remember, every patient that walks in, I always going to say, what are your expectations? Like, are you okay putting 2 or 3 things or 8 or 9 things on a day, or are you the person who you're only going to do one thing? I say, so we've got to set those expectations. With that patient, I say, okay, the first thing is we're going to train you how to find a good sunscreen. Okay, we provide amazing sunscreens here. I always say, but again, I'm not brand specific. If you bring me your sunscreen and we give you a sheet that helps you, like Sunscreen Shop, and look for certain ingredients in those, we've got to do that. So sunscreen is my number one thing. And I would say the next thing we can do for prevention is, I said, let's go to step 2. That's a good retinoid at night. Yeah. So we know that retinoids at night, they have been around for years. I've used a retinoid for over 20 years. And one retinoid is not equal to the next retinoid. There's about 100 out there. So we've got to pick the one that is right for you, your skin type, that gets you the results without all that irritation that retinoids are known for, dryness or irritation. We do know that retinoids can prevent aging, fine lines, wrinkles, helps with cellular turnover, gives you that fresh, glowing skin. So we start out slow. I would say, okay, where are we at? Okay, and I always say, bring in your products then. Where are you at? Let's look at your ingredients, okay? Let's figure out what ingredients are good in your products, which products, are not doing anything for you, which are great, and then let's see if we need to fill in any gaps. So then I love and say, okay, we got to get a vitamin. After that sunscreen, we got to get some sort of hyaluronic acid on there. So we keep like a hyaluronic acid plumping peptide that we use in the morning to just plump the skin. Because, when you just ask me questions on fillers, well, what are fillers? It's hyaluronic acid.
Really?
That's what we're injecting.
I didn't know that.
So guess what? Most fillers.
Yeah,
okay.
Sure.
Like 90% of fillers that you talk about. There's other types of fillers that we can kind of discuss too. But most of the general fillers that most people have are hyaluronic acid. So we take hyaluronic acid serums, put it right in the skin, and that artificially plumps up skin. Because what does, you'll hear the word HA, that's hyaluronic acid. All that does is just attracts and pulls in water. Well, guess what? When I put that HA on your skin, it just pulls in water, plumps up, helps with those fine lines. Same thing if I inject that right deep in your skin, it's going to plump it up, attract water, and make your cheeks look, just beautiful, or accentuate your chin if we need to pull your chin down. So I think that those are other things to just artificially plump the skin. We do different vasoconstrictors, other things with caffeine, other anti-inflammatory things around the eyes. I think those are, you've got to have special products around the eyes because the skin around the eyes is specialty skin, okay? So we've got to treat it like special skin. We can't treat it like the rest of our face, okay? Other things, besides our vitamin C's in the morning, we've got that sunscreen then. At the evening, we're going to make sure that we use something to get all that stuff out from the day, the pollutants, the, other things that we've kind of come in contact with that can degrade the skin. I love different alpha and beta hydroxy acids to use at night, and then getting that retinoid at night. And then I would say we can get fancy in there. Once my patients say I've mastered, these one product or 2 products or 3 products, I say, okay, you're ready for the next. Okay, I'm not going to throw 6 things at you at once because then we're just going to fail. Okay, let's successfully implement just a basic regimen, then we'll add on, and then we'll start talking about like growth factors, maybe we can use, or other specific things, neck creams, repair creams, other things that we need to do. But you cannot overwhelm a patient, okay? And then you just have to realize that you can't add too many products at once because we've got to see, if we add too many things and we don't have good results, we have to figure out, well, which product is it?
I love the breakdown of all these products and all these different, ways that people can prevent. But I also love that you have your patients bring in their products or bring in a list and you analyze that. What do you feel like is an overhyped product that you see continually your patients bring in that you're like, this is not doing a lot for you?
Oh, I think it changes every 2 years, and I just think, I can tell what the trends are kind of right now with them, like maybe we should put your money elsewhere.
Yeah.
But I still remember when I started my business 14 years ago, we didn't even have products necessarily. And so all my patients were literally rolling a suitcase in with all their products, and we would open it up and I would be like, oh gosh, how much did you spend on this? $3,000 a product. And you're like, all of these products that say it's treating your brown spots, there's actually no ingredient in them to actually help your brown spots. So we have to remember the power of advertising. There's so many things that will just say anti-aging cleanser, anti-aging cream. Well, any product can say that.
Yeah.
But I can't expect the average consumer or patient to actually be able to know what those are. And I should say that we have a lot of really savvy patients who have done a lot of research and figure it out. But I think just overhyped of anything can be just over marketed, for it. So just, when it says it's anti-aging, dig into it. Well, what about this is actually anti-aging, type of thing. It might be as simple as it has a little bit of sunscreen in it, but maybe it's a cheap chemical sunscreen, and now they stamp a little thing on there that says this is your favorite anti-aging cream. I think we could do a lot better than that. I think some of the trendy things, like I said, it changes every 2 years. I'm like, oh, okay. Like right now there's all this any product with snail mucin in it, is the best thing ever. Well, I see the theory where it came from, snail mucin, it's shown to have a high percentage of HA or hyaluronic acid in it.
Okay.
So people are like, it sounds so fun, it sounds so trendy, it's rare, we charge so much for it. There's so many other sources of hyaluronic acid, okay? And you can get just as good results from it. So, but it's fun, it's trendy. I've seen all these things with jade rollers and every sort of stone out there made into a roller, and so it's all just different things to bring down inflammation and move fluid around. But in the end of the day, if you eat right, watch what you're eating, make sure you're not having fluid retention. Those are just other basic things I think that you can do. So I think the biggest thing is don't get caught up in the hype, of it. Stick to your basics, and I would say, don't, just because it costs, $400 doesn't necessarily mean it's worth $400. So I just caution you, do your research. If you feel like you do your research and you're struggling with it to know if it's good or bad, certainly come in, meet with one of our skincare consultants. You either schedule an appointment with me or with one of our aesthetic gals, and say, bring your products in, and we'll look, and we might say half of these are good, half of these are questionable. And we say, let's fill in the gaps with a couple other things, type of thing. So I think it's buyer beware, out there. And it's like in the last 14 years, it's just exploded with products. So
totally.
I feel bad for my patient and consumers. How do they possibly weed through that without going on to medical school and a dermatology residency? I've studied this for years. So and so I think just asking for help, I think, is really helpful. And I think be very intentional. Why are you using this product? I'll sometimes ask the patient. They'll say, I don't know, because it's an anti-aging. Well, what is it about your skin that bothers you? I think that's we get to it. And they'll be like, well, it's my wrinkles. I'm like, okay, well, we need to pick something else. One patient will say, it's my red spots. It's my veins on my face. It's my brown spots. And I'll say, well, then this product is right for you or wrong for you, or no product in the world is going to take away those vessels on your face. We just need to do 1 or 2 lasers and they'll be gone. So stop buying product, on those. Let's just do a laser and a sunscreen and you're good to go. So I think that is really getting down to it. And I think when a patient comes in, I literally hand them a mirror and say, well, what is concerning you about the face? They'll say the spots in my face. And then I need to make sure I'm very intentional. Is it the brown spots? Is it the red spots? Is it the white spots? Because when I look at a patient, I might say, I might look at something different than you're like, you're concerned about a spot over here. And I'm like, oh, okay. I didn't realize we were talking about that spot. Yeah. So I think it's being very intentional. What is the issue? And then it's just picking the appropriate treatment regimen. And I think that's probably one of the biggest things that we can help people with is weed through, all that and decide, well, what is your problem, your diagnosis, and then what are your options to treat it? And then they can take that information and decide if it's, if it's something that they want to pursue or not.
Yeah. Gosh.
Totally. Yeah.
Well,
we're coming back. We're coming in, but we do have a really fun game.
Uh-oh.
Are you ready for the game?
Yes.
It's super fun, and I think we sent that too, but it's called Dr. Ness Prescribed. And so we're going to give you, I think there's like 8 different
scenarios
to do with skin, and then if you can tell us what you would recommend, whether it be a treatment, a product, whatever you think is best. So one thing to improve complexion.
Improve complexion, I would definitely say something, I would say hands down, getting my patient on regular hydrofacials, exfoliants, and retinoids, and a good skin toner. My favorite ones I use is our Calm and Clear Toner because it's got a little salicylic acid, a little bit of sulfa for any of those inflammatory lesions, and a little bit of azelaic acid. It's going to do wonders and tone and work out those pores every day. And getting that retinoid at night to even out that complexion, and then getting you on a hydrofacial regimen to keep that skin fresh and moving and exfoliating is just going to be a great thing for evening out your skin tone.
I love it.
Literally want to schedule one
Me too.
tomorrow. Okay, what about dry, flaky skin?
Okay, here we live in Fargo, North Dakota, so I mean, everyone has had dry, flaky skin the last, 5-6 months. I think of one, as you just heard me talk about, you need an HA, so our hyaluronic acid plumping peptide, okay? And I'm a big layer, so I say you got to put these things on 1 to 3 minutes after you get out of that bath or shower, after you wash your face. Put on that serum first, and then I'm going to have you put a second moisturizer on over it to lock it in. One of my favorite ones is, our redness reduction antioxidant cream because it's got so many anti-inflammatory. But the next patient who's got really dry skin needs their deep recovery, cream. It's got a little more oomph. Or you might be the gal who needs that night recovery cream at night. Yeah. So you've got to keep that skin moist so it's got time to repair itself. So dry skin, something that's got, and my other favorite, my ceramide moisturizer. We have an antioxidant ceramide moisturizer. Cool. And I love that one because it can actually be used on face and body. So if you've got to do one thing, and because you're traveling, you're going to the lake, you're going on a friend's weekend, you have one bottle that you literally, it's got your antioxidants, it's got your ceramides, which are the fats in your skin that we need, that can be depleted. So that's another really, really great one.
And so good to make sure you're not just focusing face only.
Everywhere.
I love that.
I do too.
Well, don't forget, yes, you can tell the age of a woman, not by her face, but by her neck and the backs of her hands.
Yes.
So because we all forget.
Sunscreen when we drive.
Yeah.
Sorry. Don't interrupt.
Thank you. Sunscreen when you drive. Yeah. And we forget about our necks. So all of our skincare sometimes ends here. I say, no, let's extend it all the way down to our neck. And then whatever you've got left, put that on the back of your hands.
I did not
even think of that.
Yeah.
Okay, good to know.
Because we do a lot of women that come in here and they're gorgeous, and all of a sudden you look at their hands and you're like, wait a minute, there's 20 years between their face and their hands. So we do different things, lasers in the back of the hands. We do fillers on the back of the hands, on that area to rejuvenate. I mean, it's hand rejuvenation,
We're staring at our hands.
Because you guys don't know anything about this yet.
No.
I'm in my mid-40s, and so, I mean,
you can't even tell. Are you kidding me?
Well, this makes sense.
Right.
Because you look unreal.
It's lessons from, and I'm very subtle. I do just very subtle things, just maintenance types of things, but take words from a wise old woman, that you need to just be ahead of it.
Yes.
And remember
I will do whatever you tell me.
Remember your neck and remember your hands. Yeah.
That's great advice. I love that. We're going to make a video on that. Your neck and your hands. Okay, wrinkles.
Wrinkles, retinoid. I mean, that's just boom. That's where I go. So we've got so many great things. We have retinoids. One of my favorites is our 10X retinoid for those that just haven't even if your skin's never seen a retinoid, we're going to shock it. So we're going to have to retinize you. So we'll start out, with just, a nice retinoid, maybe twice a week, maybe 3 times a week next week, 4 times a week, 5 times a week. Get that skin retinized, And eventually we might add in a little bit more and pulse in a little bit more of a potent retinoid to get in there. And so, I mean, that's hands down your number one thing is going to be your sunscreen in the morning, a little bit of vitamin C in the morning, your retinoid at night, and then throwing in some lasers, and a little Vivace on that one. And then, and our Botox Dysport neuromodulators to soften those lines, is going to do wonders for your wrinkles.
Perfect.
All right, what about oily skin?
Oily skin. We keep an oil control pad here. I mean, the name says it all, oil control pad. But really what you're looking for is we're going to put you an exfoliator. We have another exfoliating pad we keep with glycolic acid, lactic acid, salicylic acid, specifically just to help, with that. Now, keep in mind, I'll have some people that come in, the reason why their skin is oily, is because that they're too aggressive with their skin, okay? So they're
Interesting.
overusing products, and our oil glands are smart. If they have too much irritation, it actually starts kicking out oil, and then they're irritated, so it's kicking out oil, so it's this vicious cycle that they get into, okay? So they've got all these dry patches here, oiliness here, and it's just this combination skin, you know, we have on there. You can't even figure it out if your skin's dry or oily. And I said, I think I know what's going on here. You know, I think we've got maybe, you know, some oily skin. We're overdoing things. We're producing too much oil. So we've got to find that neutral ground, I think, in there. But I love doing my alpha hydroxy acids, beta hydroxy acids, our oil control pads. We have a beautiful sunscreen that is a matte, kind of like an oil mattifying type of sunscreen, which just helps absorb some of that mattifying. Plus, we have a little powder sunscreen that we can use throughout the day just to touch up, so then you can mattify and de-oil yourself throughout the day and get sun protection at the same time. So that's a nice way of just touching yourself up after work. You're like, oh gosh, it's 4:30. I want to go outside on the patio. I'm getting oily. Do I have to redo my makeup?
Right.
Just keep a little powder, you know, mattifying sunscreen. You can go outside, you know, have happy hour outside, plus get a little sunscreen, plus not look like an oil slick.
Right.
You know, at the end of the day.
Perfect. Yeah.
So we love a twofer.
Yeah, a 2 for 1. Okay, what about uneven skin tone?
Uneven skin tone, that kind of depends. You know, sometimes is it because you've got, as we age, okay, look at a baby. A baby is like, we call it monotone, one color. And as we age, all of a sudden we're like, why do we look old? It's because we've got red spots, brown spots, white spots. So those are kind of your uneven skin tones. Or sometimes textural issues, because we've actually got acne scarring or scarring from other things, or wrinkles. So really evening out skin tone, I always say I bring in lasers all the time. Those are my favorites. I mean, that's really how you can get rid of all those little broken blood vessels. A lot of us are fair Caucasian women, you know. We've got lots of broken blood vessels, little blood vessels. So getting rid of the reds, we'll use some lasers to basically clamp down those vessels. Then we might bring in a different laser to help with the brown spots, you know, on those, to get rid of the browns. And then we're going to get you on some good products, you know, to continue evening out that skin tone. So I think when you say skin tone, it all depends on really what it is.
Sure.
Or I might bring in something else, like if it's a really significant like textural issue, that's where we'll bring in like skin pen microneedling or a CO2 ablative laser.
Yeah. Yeah. All right. Last one.
Okay.
Large pores.
Oh my gosh. Can I count how many times a day people ask me this? Because I'm part of the large pore club. You know, I mean, if you look at my genetics, so one thing is I tell them, I said, it's not your fault, it's your genetics, okay? You know, I look at, you know, family members, we just have large pores, okay? And so I know I've known my whole life, I've got to fight that. So things that we can do is, one is you got to make sure you're on the right products, okay? Again, retinoids, because we want to get all that stuff kicked out of those pores, because if your pores get bogged down, they're congested, it's like that open up and they just get kind of boggy, okay? So we want to make sure we're kicking all that stuff out of there. We're using a good skin toner, okay, on that area. And then really what we want to do is oftentimes to actually help kind of shrink them down. We'll give you, we do have some products too. So we actually have like a pore minimizer that you can actually topically put on. But then we typically get you in for skin pen, microneedling, Vivace, microneedling radio frequency to help tighten and actually decrease pore size. So definitely pores are something that we've got to do two different things. Good skincare, and typically we're always doing some sort of technology, you know, to help with those. But we are not alone, us large pore sufferers.
Well, it's working, whatever you're doing, because I literally can't see a pore on your face.
I know, me too. I'm like, large pore, really?
Where?
We work hard. We work hard on keeping those pores under control.
So our final question before we talk about how people can connect with you, we always try to ask our guests, what does a queen mean to you?
A queen. So, well, I always think one of my things is, you know, I think that's such a great thing, your guys' platform of the queen is, and first my number one thing is, I think a queen is something that you can't self-declare, you know, like that you're a queen. I mean, it's like a queen is something like, it's like a title that you've earned, I truly think, you know. You can't go and just, you know, go online and buy yourself a crown and self-declare yourself you're a queen. I mean, it is true. That's a false queen, okay?
Yeah.
To be a true queen, I mean, I think that you have to earn it, you know, and so, and I was like, the first thing that goes to your mind when you think of queen, what do you think of? Like, bee queen, you know, like, you know, the queen of the beehive, you know, and you always like, if you like parallel, like, what does a queen do in that beehive? Okay, they've got one little queen in that little thing. the queen isn't the one who's like necessarily doing all the work. The queen actually like submits a chemical to keep everyone. There's some interesting like chemical physiology that goes on to keep them, all the rest of the bees, happy, all working together, keeping them all like on the same thing. So they're helping to keep this like a happy beehive. The queen's job is to keep everyone moving, everyone inspired. So it's making lots of honey. She's laying eggs. We're making more bees, you know. And so it's really is to keep everyone working in the same direction, you know. I also think I was listening to, it was like a month ago, and I was listening to a podcast on grit, and it was like the grit factor. And I'll steal a quote from there. She was just talking about how like it being specifically women in leadership, you know, in there. And she talks about like the only good, you know, that comes from increased leadership and power is the responsibility to help those on your team. So I think of the same thing, like that leadership is truly a sacred trust, you know. And if if you have agreed to take that title, you know, of being a queen, like you've taken on a huge sacred trust, and your job now is to help those who are in your beehive, who are in your team, who are in your clinic, who are in your business. And so don't use it inappropriately. I mean, I think it's, if you choose to take that role, like choose it wisely, you know, and use that leadership and use that wisely and help your people. You know, if you help your people in your beehive, you know, if you protect your people, they're going to protect your mission. And whether that's your mission, your business, your mantra, whatever that is, that's, I think, your job. So I think it's something, a title that is an amazing title. It comes with a lot of weight. It comes with a lot of responsibility. And I think before you choose that you want to be a queen, you know, like make sure that that's what you want. And then you've got to really kind of follow through with it. So that's what I think a queen
That's perfect.
is.
I love it. Yeah. That was
we've
really
never
good.
heard an answer actually even close to that.
I
And I'm
know.
obsessed with it.
Same.
That whole analogy. And you know what?
We're just all a bunch of beehives.
I love it though. I love it. And it totally speaks volumes to you and your team here. They're so lucky to be under you. And I know that after listening to just a little bit that we've got to speak with you about, everybody's going to want to be connecting with you. So plug away. Tell us where we can follow, connect, make an appointment. How can we stay in touch?
Absolutely. So I think that goes back to, we have a wonderful beehive or team here. Like, so kudos to everyone that's here. I mean, I am nothing without my beehive and everyone else that's on my team. So if you want to meet our wonderful team here at Fargo Center for Dermatology, our website is fargoderm.com. You certainly can also connect with us on Instagram, also on Facebook, also on TikTok. Otherwise, feel free to give us a call at any point. It's 701-478-8780. But I think our website is probably the easiest way. You can learn a lot about us on our website and our Facebook and Instagram. And if anyone ever wants to come in and meet with us, you can always feel free to call, make an appointment, because you will not be disappointed, because this is truly, we always kind of describe it our A-team, which, by the way, when we open our new aesthetic wing, we're opening a new thing, and it's really literally called, you know, the A-team. And so it's a really neat thing, and I think we've always called our team that from the beginning. Like, we truly have some of the best employees here. I mean, these are just extremely highly competent, highly trained people. Everyone here is truly, you know, handpicked to be part of this team. And so I think that you can trust that anyone that you receive your care from here is just amazing.
Well, we'll link everything and send everybody your way. We're so excited. Thank you so much.
Yes,
Thanks for having me.
Fun.
So
Thank you.